ಹಾಯ್ ನಮಸ್ಕಾರ ನರ್ಸಿಂಗ್ ಲೋಕ ಯೂಟ್ಯೂಬ್ ಚಾನಲ್ಗೆ ಸ್ವಾಗತ. ಇಂದು ಮೆಂಟಲ್ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಇಂಪಾರ್ಟೆಂಟ್ 4 ಮಾರ್ಕ್ಸ್ ಕ್ವಶನ್ ಆ್ಯಂಡ್ ಲಾಂಗ್ ಆನ್ಸರ್ಸನ್ನು ನೋಡೋಣ ಬನ್ನಿ. ದ ಫಸ್ಟ್ ಕ್ವಶನ್, ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಟೀಮ್. Mental health team is a group of professionals who works together to provide care, treatment and support to people with mentally health problem. Members of mental health team, the first one, psychiatrist, a medical doctor who diagnoses a mental disorders and prescribed medicine. Second, clinical psychologist, helps patient through counseling, psychotherapy and psychological testing. Third one, psychiatric nurse, provides nursing care, observes behavior, administrates the medication and supports the patient emotionally. Fourth one, psychiatric social worker. It helps the patient and families deal with the social and emotional problems, arrange the community support. Occupational therapist. He helps the patient develops the daily living and work related skills to improve the independence. Sixth one, counselor. He provides the guidelines and emotional support to help the patient cope with the stress and life problems. Seventh, recreational therapist. He uses the creative and recreational activities like art, music or games to improve the mental well-being. The next question is 4 marks that came in August 2018, April 2021, January 2023. So that first question is National Mental Health Program. Second, explain in brief strategies of National Mental Health Program. In long answer also they asked 1 plus 6, 7 marks. Define National Mental Health Program and explain in brief strategies of National Mental Health Program. The answer is the Government of India launched the National Mental Health Program in 1982, keeping in the view the heavy burden of mental illness in the community and the absolute inadequacy of mental health care infrastructure in the country to deal with it. Next, strategies of National Mental Health Program. Integration with the general health services. The mental health care is integrated into primary health care at all levels. Second, training of health personnel. Training of medical officers, nurses and healthcare workers to identify and manage common mental disorders. Third one, public awareness and education. Promoting awareness to reduce the stigma and misconception about mental illness. Fourth one, community participation. Involving the community and family members in prevention, early detection and rehabilitation. Fifth one, availability of essential drugs. Ensuring continuous supply of psychotropic medicines at all healthcare levels. Sixth one, monitoring and evaluation. A regular supervision and evaluation of mental health program for effectiveness. Next, fourth question, trends in psychiatric nurse. Trends in psychiatric nursing. The first, community-based care. Focus has shifted from hospital care to community and home-based mental health services. Second one, holistic and patient-centered approach. Emphasizes on treating the patient as a whole considering a physical, psychological, social and spiritual needs. Third one, use of psychopharmacology. Increased use and understanding of psychiatric medications for effective symptoms management. Fourth one, multidisciplinary teamwork. Nurse work along with the psychiatrist, psychologist and social workers as a part of a mental health team. Use of technology and telepsychiatry. Online counseling, mental health apps and telehealth services are growing trends. Sixth, emphasizes on preventive and promotive health. Focus on early detection, prevention and mental health promotion in schools and communities. Seventh, evidence-based practice. A nursing care is based on scientific research and best clinical practice. Fifth question, functions of psychiatric nurse. Answer, the functions of nurse in various settings. Inpatient psychiatric ward. Provide environmental safety including protecting the patient and others from the injury. Second, promotion of self-care activities. Third, medication management, assisting for somatic therapies, accurately observing and documenting the patient's behavior. Next, B. Psychiatric outpatient department. In that, first, performing clinical assessment. Second, assisting or providing psychotherapy or behavior therapy. Third, conducting group therapy. Fourth, delivering psychoeducation. C. ECT treatment setting. In that, first, teaching the patient prior to ECT treatment. Second, preparing the patient for ECT. Next, providing care during the procedure. Next, assisting with post treatment. Last, providing reassurance to reduce the anxiety. D. Psychotherapy unit. In the first one is establishing a therapeutic relationship with the patient. Next, providing opportunity to practice new skills. Providing consistent emotional support. E. Daycare center or day hospitals. In the first one is accurately observing and documenting the patient's behavior. Second, medication management. Third one, teaching social skills. Fourth, counseling patient and family members. So next one is the family therapy unit. In that first one is the assessing individual and family needs and resources. So next is the facilitate of families use of positive coping strategies. Next, promote the adaptive family functioning by teaching communication skills and problem solving skills. Next, delivering the psychoeducation. G. Child psychiatric ward. In that, assessing for biological and psychological needs of the child. Next is the teach the child adaptive skills such as eating, dressing, grooming and toileting. So next point, providing emotional support to the parents also. H. In that H, community mental health center. In that first point is identification of patient in the community. Second point, refer the patient to appropriate hospitals. Next, home visiting and providing direct care to the patients in community. Next one is the conducting public awareness program to remove the misconceptions regarding mental disorders. So next is the emergency department. In that first point is the crisis intervention during the natural disaster, accident, unexpected illness causing the increased anxiety or stress. Second point, obstetric nursing centers. Next is the helping the mother in labor and support the person to cope with the anxiety, stress during the labor. So next question is characteristics of mentally healthy person. So that short answer 4 marks they asked in August 2009, February 2020. Even though they asked in long answer August 2014 and January 2023. So that question is A. Define mental health. So that I explained in a 1 marks question answer. So B is the enumerate characteristics of mentally healthy person. So now I will explain only the characteristics of mentally healthy person. Answer characteristics of mentally healthy person. In the first one is he has an ability to make adjustment. He has an sense of personal worth, feels worthwhile and important. He solves his problems largely by his own effort and makes his own decisions. He has a sense of personal security and feels secure. So next point is he has a sense of responsibility. He can give and accept the love. He lives in a world of reality rather than fantasy. He shows the emotional maturity in his behavior and develops a capacity to tolerate frustration and disappointments in his daily life. And next point, he has developed a philosophy of life that gives meaning and purpose to his daily activities. So next is he has a variety of interest and generally lives a well balanced life of work, rest and recreation. Next question is scope of psychiatric nursing. Short answer 4 marks. They are asked in August 2014, January 2012 and June 2022. Answer is the scope of psychiatric nursing. The scope of psychiatric nursing includes caring of individuals, families, and communities with the mental health problems and promoting a mental well-being. It wide and covers many settings. A. Preventive mental health care. In the first point, promoting mental health awareness, early identification of mental illness, stress management, and counseling. Next, B. Curative care and treatment. Nursing care for patient with mental disorder, administrating a psychotropic medications, observing and reporting patient behavior, and assisting in therapies. C. Rehabilitative care. Helping the patient regain social and occupational skills, occasional training support, follow-up care after the discharge. D. Psychiatric nursing in hospitals, care in psychiatric ward and mental hospitals, crisis intervention and suicidal prevention, maintaining a safe therapeutic environment. Next, community mental health nursing, home visiting and community clinics, mental health education, support for families of mentally ill patient. F. Child and adolescent mental health, in that managing the behavior and emotional problems, school mental health program, counseling children and parents. Geriatric psychiatric nursing, in that care of elderly with dementia, depression and anxiety, emotional support and counseling. H. Teaching and research, in that teaching the psychiatric nursing students, conducting mental health research, improving the nursing practice. The last one, legal and ethical responsibility, in that protecting patient rights, maintaining the confidentiality, assisting the legal procedures related to mental health. Thank you for watching. Please do like, share, comment and subscribe to my YouTube channel. Thank you.